Hi, I'm Russ Barksdale, President and CEO of Waveny LifeCare Network, and I'm proud today to be sitting here with Kevin Moynihan, First Selectman of New Canaan, Jen Ilson, who's the Director of the Department of Health, and Bethany Zaro, who's the Department of Health, Director of Health and Human Services. We'd like to thank them all for all the work that they've been doing, both for New Canaan and for our residents. Today's topic will be surrounding COVID-19, both testing and the vaccines that they've been rolled out over the past 3 weeks. So my first question is for you, Kevin. Knowing that there was a little bit of controversy over the methodology that was used by the state in rolling out, what do you feel were the reasons that each town received a different amount of vaccines per week, and what is your understanding of the number of doses that each town will receive in the future?
Thank you, Russ. Good to be here with you today, and thanks for moderating this program. We were initially concerned that perhaps New Canaan was getting shortchanged. They only gave us 100 doses for our local health department clinic at Lapham. But overall, I think the state of Connecticut is doing very well. We've been fortunate to have them increase our dosage to 200, which we administered yesterday at Lapham Center. And we were, now that we're in the phase of the 75 and older population, it's been quite a chore to assist this element of the population to be able to find appointments and to serve them. But I think we're probably up to 80% by this time, and by early next week, I think we'll probably be done with 75-year-olds in New Canaan. So it's gone very well. It's really just taken 3 weeks to get to where we are. And the state overall, I think, is soon going to turn to the 65 and older. And I'll let Jen address the next phase we're going to go into.
Absolutely. Jen, help us understand the state's priority. Instead of having like a 1, 2, and 3 phase, they came up with a 1A, 1B, and 1B1, 1B2, and 1B3. Help the community just understand a little bit kind of where we are now and what that looks like for people over 65 and even 55 and older going forward.
So when this first rolled out about a month ago with 1B, they basically put too many people into the 1B pot, so to speak. So there was, over 1.5 million people that had qualified under 1B. So what they decided to do is then further break it out into waves of 1B. So they started obviously with the most vulnerable and the ones that have had the high mortality rate, which is the 75 and over. Then the next phase, as Kevin alluded to, will be the 65 and over. And then from there, they may add in those that are vulnerable with comorbidities and high risk. And then from there, they're going to go to essential workforce, educators, child care workers. They're still finalizing the definition of the essential workforce, but they have a working definition now on the state website of, that alludes to like grocery store workers, restaurant workers, and then anybody else in the industry. So right now we're in the phase 1B first wave, so to speak, and then hopefully next week we will begin to 65 and over.
Thanks. You guys have done a great job, and I know the first 3 weeks of the vaccination, we've heard a lot of great things of how smooth the process has been in town. Bethany, some of our town residents do have access issues, either because of comorbidities or other physical rehab issues. What can we do, and what has your department done to help with some of those access issues and the difficulties that they may have going through the website, the VAMs, and registering?
Exactly. Thank you, Russ. The technology that was set up for this registration process was way beyond many, many people. And so as the Human Services, our role was to do an outreach to let people know we were there, as well as to take one person at a time and get them through the registration process. It was very non-user friendly at the beginning. It was everybody's first rodeo, it still is. A lot of adult children were calling saying, I can't even get on this VAM's website. So we were helping the age spectrum from adult, child, for their parents and up. And it became very clear that absolutely a call out of letting them know that we are here to help was just paramount in terms of getting our community vaccinated. And at the same time, you have to be very careful of HIPAA compliance and things like that, and respecting the personal information and the dignity of the person. And so it was a fine line, but people definitely, with the Lapham Flu Clinic, that is absolutely seamless. And now the hospitals in the area have opened up as they receive more supply for the vaccine. And as the older population is getting vaccinated, we're going down now to 65 and up, which they are more technology savvy. And so that is going to create a much better rhythm in terms of getting the registration process going.
100 a week, Kevin, and then 100 a week the second week, then 200 the third week, and continuing on. It's been rolled out a little bit slow, and I know some of the healthcare providers were able to access vaccines to the Pfizer and the federal programs early on in December. Why is continuing the testing program and continuing the vaccination program and increasing the vaccination program very important to our local businesses, our schools, and our economy?
Before I get to the mentioning of the testing, I'd like to tell our audience that if you have a parent over 75, or if you are over 75 and you haven't been vaccinated or you don't have an appointment, you can call 203-594.
3076. Oh,
Yeah, or 3037.
Both our health department and our human services department will arrange for you to have an appointment. So anybody who is listening and doesn't have an appointment yet, please call New Canaan Town Hall to get an appointment.
And we'll post those numbers during the program on the screen for those individuals, along with the website.
Thank you. But we're not out of this tunnel. We can see light at the end of the tunnel, but we're not out of this tunnel of the COVID pandemic. And on the other hand, vaccinating our first responders and the medical personnel first, we are now protected. The governor is very happy that our hospitalization level is trending down in the second wave, and that's an indication that we're getting the virus under control. But it's still out there. In fact, the variants are beginning to appear, and so we have to be very careful that we don't let this success we're achieving in Connecticut, compared to many other states and especially other countries, turn around and become a problem for us. So we are making, courtesy of Waveny Care Center, I should thank Russ. Since, when did we start it? November, the end of November, we've been testing at Lapham Center 6 days a week. We stepped it down to 3 days a week, Tuesday, Thursday, and Saturday, and we will maintain the testing so that anybody who is traveling, anybody who's concerned that they may have symptoms, can get tested, and we will have a good handle on what our local situation is. If you read the newspaper, the state of Connecticut positivity rate has dropped down just below 4%, which is good, and we're probably in the 2 to 3% range right now. So we're going to continue the testing. It's very important that people with any indication that they have a concern that they go get tested. So,
Jen, you and your staff have been working tirelessly nonstop for almost the last year. I think the end of this February actually starts the first day that we were aware of COVID coming into Connecticut. What additional support could your department and your division have from both the state and our local governments that you feel that you need in order to make more progress in fighting this disease?
Well, that's funny because this is the topic of the Directors of Health today, of trying to get legislation to get funding for local health, because I don't know if our viewers know, but any town that has under 50,000 population residents or less than 3 towns as a district gets 0 per capita dollars. So that means it's all funded by the town of New Canaan and New Canaan taxpayers. So now that they have a surplus and they have, the pot of gold that they've gotten from federal government, so to speak, local health is fighting to eliminate those barriers, and that every local health department should get funding because, if anything, we've had to do more, not less, because, we didn't have testing sites in New Canaan. We've had to figure that out for a year of continuously pulling that in. And so we've spent a lot of money, and that's like, the one thing. But I must say, Kevin and Cheryl and everyone's been great about getting support and temporary workers, both for the test site, for, the vaccine site, and then having additional administrative help has been a huge difference with my staff. So I must say the town of New Canaan has been very supportive of anything we need.
And
So-
you seem to always have a ton of volunteers that are by your side as well. So that's an awful great thing to say about our town and our community, their willingness to work with you, and I know also with Bethany. COVID fatigue, we talk about it. Social isolation for seniors, increased anxiety, depression, all are real, especially since we've been under this cloud for now almost a year. What do you see as the signs and symptoms that you're experiencing with your department and your division and your staff that they are seeing in the community, and what programs and services have we been able to put together to offer to them?
So, great question, Russ, because this 1 year COVID creep has just absolutely taken a lot of energy out of a lot of people, and with the unknown. And so when you have a year of this climbing up to really we don't know where, we're seeing it with the clients. Just when we call them and do an outreach, hi, how are you? Their voices sound tired. They sound tired. And so that is our clue of how important it is for us to keep talking to these people. We're in it together. And so this is how we have structured our outreach is, you're not alone. We're here. Even though Human Services, we are a resource for the town, we do not have long-term counseling that's necessary, but we do have resources. The Hub, Connecticut, hubct.org, great focal point to see what everybody is reacting to this differently. But the bottom line is when someone calls and they need help, you can just hear it in their voice, like, is there anything that I can be doing, or is there anyone I can talk to? This is a great resource which has stayed totally up to date and given resources in our area that we can focus on and find someone for somebody to talk to. There are other organizations, SWACA, the Southwestern Connecticut Agency on Aging, that's our area for Connecticut, and the caseworkers, the counselors, unbelievable in terms of the outreach. And I think that the silver lining is everyone has come together on this. We have to, and no one is alone, but you need to hear that we're in this together. So our thing is to call Human Services. We can listen, we can figure it out, we can work with you, and it doesn't mean that we find someone and then we're gone. We are continual outreach focus for the town, but we also need other resources for people as well. We can't handle it alone.
Yeah. Jen, you and I have been tracking the variants of the viruses that have been coming out there, the production of the vaccines that are coming out. From your perspective, why is it important? Some people have been sitting at the sidelines and saying, I'll wait, for the next series of vaccines to come out. Why do you feel it's important that we continue to access testing and the vaccines when they're offered to us?
Well, I think what the public needs to remember, we're still a red state right now. I mean, that's just reality. The case numbers, even though they're down, if you look at, the case over the 100,000, you're still red. You also have to remember that Moderna is only for 18 and over. Pfizer is 16 and over right now. So, the teenagers and that demographic are not going to be able to be vaccinated, at least, in the coming months. So it's very important that they continue to get tested, because there are still some, not only just elderly, but immune compromised, where their doctors won't let them get vaccinated. So again, you need to make sure if you're going to be around people, that you continue to test. And it also, like Kevin said, gives us a surveillance of what's going on. Last year when we brought in Stanford Hospital in May and June, we saw that it plummeted to zero, and hopefully we continue that. And then now that we've been doing so many months of testing with Waveny, it's been great to see the trends. And if you look at the charts on the website we've had a really long sustained wave, but that was expected with all the holidays and the gathering. So it's great for everyone. It's great for Brian to be able to make his decisions with the school, with hybrid and what goes on. So it's very important that people continue to test because asymptomatic spreaders are still out there, you know. And the reality is the teenagers and youth will not be vaccinated, at least in the next coming months, until those clinical trials are over.
Kevin, we'll give you the last word on this. We could certainly end up talking about this subject for a couple of hours, but our time is limited this afternoon. You've been sending out weekly and sometimes even daily communications since the first wave hit of the pandemic back in March of 2020. Whether it was communicated through the director of EOC or another town official, the message was clearly yours. What is the role and what authority has the state provided you to oversee our response to the pandemic? And what can our representatives, our local representatives in our own town and our own community do to really help you and your team in your efforts?
Well, mainly our role has been to communicate and interpret and to enforce the governor's orders. We've been in a state of emergency since last, I think, March 9th. It's been a long 11 months. I give the governor a lot of credit. He's been very measured. He's been very thoughtful. So I think the state of Connecticut has done very well, and the town of Canaan has done very well. We're very fortunate with the team of experts we have, including yourself, including our two medical advisors to the town. Jen's health department has done a fabulous job, and as Human Services has done as well. So I thank you all, and it's been but this pandemic is not over. It gets a bit sing-songy, but I end all my weekly out calls by saying, continue to wear your mask when you can't social distance, wash your hands frequently, and maintain social distance. And that is what we still have to do. It's very important that people realize this bug is still with us. It's going to be with us through the next several months, and only until we get to that point where a majority of our residents are vaccinated, and then we reach herd immunity, that we're going to be able to corral this virus. So I want to again thank Waveny Care Center. You've been a great partner, both with the testing and protecting our seniors. So thank you, Russ, and thank you, Jen, and thank you, Bethany, for all we've done.
Thank you, Kevin, and what you've meant for this town and your leadership. We'd also like to thank Jen Ilson and for Tyler's efforts for her and her department, Bethany Zorro for being there and helping support through Human Services. We'd also like to thank Channel 79 and its viewers. Timely and accurate information on COVID and the vaccines and testing is critical to our community to get past this pandemic. So we'd like to thank you. We'd like to thank you for all your donations of both time and money to this effort that everyone here has participated in. And we thank you for your continued support. Have a good evening.